The Fresno County Health Department is reporting an uptick in COVID-19 cases countywide. This comes after cases were declining for the past few months after a high this winter. CBS 47's Catherine Phillips joins us live in studio now. And Catherine, what are officials saying?
Well, Catherine, officials with the Fresno County Department of Public Health say COVID cases have been on the rise for the past 6 weeks. And while they are keeping an eye on this rise, the surge is not anywhere close to the level we saw this winter. Over 2 years after the first cases of COVID-19 were reported in California, officials with the Fresno County Department of Public Health are once again tracking a rise in COVID-19 cases. Officials with the health agency say since the week ending in April 23rd, which was 6 weeks ago, cases have been steadily rising. 6 weeks ago, the county reported less than 300 cases in a week. Now they're reporting over 1,000. Dr. Kenny Bond with UC San Francisco and Fresno says they're watching the rise closely.
Case counts have been increasing over the last couple weeks, but in the last week alone have definitely seen a big increase.
Bond says the current rise in cases is from a sub-variant of Omicron. Omicron caused the huge spike in cases this past winter. Bond says with this rise, now is a great time to get your booster dose if you haven't already. But many who are vaccinated and boosted can still get sick. He also says if you did get COVID over the winter with the first variant, you may have some natural immunity built up to this strain of Omicron.
People who are vaccinated, have gotten boosted recently, may test positive, but they basically don't feel anything, or my goodness, I got a little runny nose, a little cough. Now, there's concern because that person still may be somewhat infectious.
And with summer travel on the horizon, as people pack planes without masks, Bond says you should consider your own individual risk when making decisions and to stay home if you're sick.
You can take some personal protection yourself, right? Masking when appropriate, thinking about large group. Or should you go to that concert if everyone's going to be unmasked? Maybe you have to think about what the current case numbers are and whether you've been infected, when you were boosted, and think about your own risk.
Now, Bond says while hospitalizations are still lower than what they were this winter for COVID, other types of hospitalizations are high, so getting vaccinated can still reduce the strain on the healthcare system. Live in the studio tonight, Catherine Phillips, CBS 47 Eyewitness News.